morning, Lisa. My name's Michelle. I'm a nurse, and today I'm just going to do a quick overall head-to-toe assessment. Do you have any questions?
No.
Is it okay with you?
Sure.
All right. I'm going to wash my hands, and if anytime anything's uncomfortable or you have a question, I want you to stop me and let me know.
Sure.
Okay?
Good.
All right. So like I said, I'm going to start with your head and kind of work my way down.
Okay.
I'm going to feel around. Good. In your ears. Anything hurt?
No.
Okay. Feel for your sinuses. That uncomfortable?
Not at all.
Okay. Now, can you open and close your mouth for me? Great. And can you move your jaw side to side? Thank you. All right. Gonna feel for your pulses. Good. Good. And can you clench your teeth for me? And now I'm going to try to open your mouth, and I don't want you to let me, okay?
Mm-hmm.
Good. Can you wrinkle your forehead and smile? Puff out your cheeks and frown. Good. I'm going to take a look at your eyes, okay? Good. Now I want you to watch my pen light. Try to follow it with your eyes, but not your head, okay?
Sure.
Good. I'm going to use this visual chart. Now, can you close your left eye for me? And can you read this line?
D-E-F-P-O-T-E-C.
Great. Can you cover your other eye?
Sure.
And can you read this line for me?
D-E-F-P-O-T-E-C.
Great. Now, can you cover the same eye? And I'm going to cover them as well. Now, I want you to tell me when this pen light comes into view. Okay?
No. No. No.
Good. Now, cover your other eye. Same thing.
No. No. No.
Good. I'm going to take a quick look at your eyes. Good. Can you look at that spot over there for me?
Mm-hmm.
Good. Can you close off one side of your nose and now take a deep breath through the other? Good. And do the same thing on the other side. Good. Now I'm going to have you close off one ear,
Okay.
and I'm going to whisper something into the other ear, and I want you to tell me what I whispered.
Okay.
Okay?
Mhm.
So you can close off this ear for me.
99.
And same thing on the other side.
24.
Yep. Thank you. And can you open your mouth for me? Good. Lift your tongue up. And stick your tongue out. Good. And say ah. Good. Now normally I would test for your gag reflex using a tongue depressor, but we're not going to do that today, okay?
Okay.
All right. Okay. Now I'm just going to come to the back of you. And I want to have you swallow for me 2 times. Good. And one more time. Good. Thank you. Okay. I want to take a look at your arms real quick. Can you put them both out in front of you? Thank you. Check for temperature. Good turgor. That means you're well hydrated. Check for some pulses.
Okay.
Good. And this side. Good. Good. Can you put your hands like this? And then down. Circle with your wrists. Good. And hands out in front of you. Let's take a look at your fingers. Check your capillary refill. Very good. Can you do this for me? Test your digits. Touch all your fingers to your... Thank you. Very good. And I want you to move your hands over and under as fast as you can.
With my arms out straight?
Yes. Good. Thank you. Real quick while we're here, I am going to put a couple of objects in your hands. I want you to close your eyes.
Okay.
and put out your hand. And I want you to tell me what it is I put in your hand.
Paperclip?
Yep. And the other hand.
Pencil.
Yep. Good. Thank you. All right, I'm going to take a listen to your lungs, okay? I'm going to start in the back, and then I'll do the front. You can stay sitting up for now, okay?
Okay.
All right. Anything bothersome?
No.
Can you take 2 deep breaths for me? Good. And I want you to tell me if this bothers you, okay? No?
No.
How about that?
No.
Okay. All right, now I'm going to have you take some deep breaths. If you get dizzy, I want you to stop and tell me, okay?
Okay.
All right. Each time I move my stethoscope is a new breath.
Okay.
Okay? Okay. Nice deep breath. Good. I'm going to do the same thing on the front, okay?
Mhm.
All right, again, just a few deep breaths, okay?
Sure.
Okay. Lift up your arm. Big deep breath. Good. Thank you. You okay?
Yeah.
Okay. Okay. I'm going to have you lie back for me after I take one quick listen. Can you hold your breath for me for just a few seconds?
Sure.
Great. Thank you. Okay, now I'm going to have you lie back, and I'm going to listen to your heart, and then I'm going to take a look and listen to your belly and listen for bowel sounds, okay?
Okay.
First, I want to check to see if we can see your veins. Can you turn your head to the left for me? Thank you. And to the right? Good. Thank you. Can I remove these?
Sure.
Thank you.
Scooch down for you. Okay.
Okay, maybe from this side is better. Okay, so I'm going to listen in 5 places, and then I'm going to turn my stethoscope over and listen again.
Okay.
Okay, and just one more time on every area, okay?
Okay.
Good, thank you. All right, I'm going to take a listen for bowel sounds, okay?
Okay.
And I'm going to use the other side of my stethoscope and take a quick listen, okay?
Mhm.
taps, okay?
Mhm.
Good. Anything tender? Does it bother you to touch?
No.
Okay. Okay, good. Do you think you could scoot just a little bit back for me?
Sure.
All right, I'm just going to test some range of motion in your hips, okay?
Okay.
So I want you to take your left leg and stick it straight out. Good. And can you lift it all the way to the ceiling? And back down. Out to the side. And then cross it over your right leg. Good. Now can you do the same thing against my hand?
Sure.
Now up to the side, yep. And then in. Good. Now can you bend your knee? And move it out. And in. Good. And can you push against my knee, my hand out? Yep. And then push against my hand in. Good. Okay, put that leg down, and we're going to do the same thing with your right leg. So stick it straight out, straight up to the ceiling, and back down, out to the side, and then cross it over your left. Now come back out against my hand. Try to push my hand. Yep. And then the same way this is inside.
Okay.
Good. Thank you. Now can you bend your knee for me? Good. And out to the side. And cross it over. Good. Now try to push my hand. Good. And push my hand this way. Good. Okay. You can sit up for me. And I'm just going to take a look at your feet.
Okay.
Can you point your toes? Here, give me both feet. Point your toes. And then toes to the ceiling. Circle. Can you, without moving your knees, put your feet in? And then out. Good. Good. Are you ticklish?
Not really.
All right. I'm going to do what's called the Babinski reflex. It's just running my finger up your feet, okay?
Okay.
Good. I'm going to feel for your pulses. Look for any swelling. Good. And just check your temperature. Good. Okay. Could you stand up for me?
Sure.
Could you take about 3 or 4 steps that way?
This way.
Yes, please. Good. Now turn around and take a few steps on your tippy toes and on your heels. Good. Now turn around, and if you could take a few steps heel toe. Good. Okay, you can come back over. I want you to bend forward as far as you can. And come back up. And bend to the left. And bend to the right. And twist to the left. And twist to the right. Good. Can you put your arms out in front of you? And then up. Down to the side. And then up in front of you again. Hands up. Arms back behind you. And see if you can grab each wrist. Good. Okay. Now, I'm going to have you close your eyes and try to stand still.
Okay.
Okay? I'm going to be right here in case you get dizzy, okay?
Okay.
All right. And we're going to do this for about 15, 20 seconds, okay?
Mhm.
Can you put your hands by your side? Thank you. Good. Thank you. Last thing I need you to do is just give me your hands, put your hands out in front of you. I want you to close your eyes, and I want you to tell me which finger I'm touching and whether I'm moving it up or down.
Okay.
Okay?
Up. Down. Down. Up. Up.
Good. Lisa, that's all I have for today. Thank you very much.
Thank you.
Okay.